So, welcome back. And the big question is now, can technology save healthcare? Welcome with me from Zurich, Dr. Garif Yalak. He is the head of digital transformation, healthcare and education at Cisco. Garif will give you insights into the question where wearables and IoT can probably help doctors and healthcare solutions to provide better services. Gareth will also talk about questions like cybersecurity. He will address a hospital chain attack on the cybersecurity side. And I think Garif, Dr. Garif Yalek from Cisco, the floor is yours. Can technology save healthcare? Welcome, Garif.
Thank you very much for this very kind introduction, and thank you for having me for such a great event. Good morning, everyone, and welcome to my presentation with the title, Can Technology Save Healthcare? In the next 20 minutes, I will outline how technology can help to reduce the pressure on the current healthcare system, and we'll focus on some learnings and share recommendations that need to be taken into account to prepare our healthcare system for the future. As said, I will focus on three areas where Cisco has been delivering solutions for many years. This includes cybersecurity, video conferencing solutions, and IT infrastructure. Let's start with what we all would agree today is a fact. The pandemic has exposed the weaknesses and vulnerabilities of the current healthcare system. In many areas, we are not at the stage we actually believed we were a year ago. The healthcare system of today is not future ready and is not in a position to be agile enough to cope with situations like a pandemic or disasters. It has been a painful experience and society has paid a heavy price. At the same time, this is now a unique opportunity to set the path for a digitized, stable, and agile healthcare ecosystem that is also able to better cope with scenarios like a pandemic and keep all stakeholders protected. This brings me to the first topic I would like to cover today, cybersecurity threats in the healthcare environment. First, let me share some background information about Cisco's activities in the cybersecurity domain. Cisco has been named the largest cybersecurity company globally. We offer a variety of cybersecurity solutions. In addition to that, we have one of the largest commercial threat intelligence units in the world. This team, called Cisco Talos, several hundred people, observe what's happening in the cyberspace 24/7 and help our customers, including customers from the healthcare sector, to stay safe. Just to give you a ballpark number, Cisco Talos blocks approximately 200 billion malicious emails every single day. Now, during the pandemic, we have observed increasing cyber attacks in our healthcare environment. No single stakeholder was spared from attacks. Attackers have not only been focusing on hospitals, but also on regular medical doctors, patients, insurance companies, research organizations, and the pharma sector. Dr. Andreas Michael Meyer from Sanofi briefly touched on the urgency of protecting, for example, research and development, the supply chain as we speak. For example, some attackers have tried to obtain critical data and documents about potential COVID vaccines in the pipeline of some of the major pharma companies. The attacks are ongoing. As we speak, attackers are trying to undermine the supply chain, undermining the efforts to quickly vaccinate the population. This has been a global trend. Switzerland itself was not spared from cyber attacks during the pandemic. As you might know, one of Switzerland's largest hospital group with 17 hospitals and many more institutions and locations was victim of a major cyber attack in summer 2020. The attackers used malicious email attachments to get to the central file storage and encrypted part of critical data. It took the hospital exactly 6 days to reverse the encryption. Fortunately, in this case, copies existed and the hospital could continue regular business and keep their patients protected. This positive outcome, however, is not guaranteed in the future. For a second, imagine the worst case scenario, when 17 hospitals need to be shut down for 6 days during a pandemic because of a cyber attack, because we're not ready at this stage. This is not just a scenario, but a real risk today. A similar incident in Germany led to the first ever reported deaths caused due to a cyber attack. With a ransomware attack, most of the IT services and applications were made inaccessible for the healthcare staff at the university hospital in Düsseldorf. The hospital was literally forced to reduce their activities by 50%. Now this hospital treats 1,000 patients every single day. Imagine you have 500 patients stranded during a pandemic which cannot be taken care of. In order to help those patients, the hospital tried everything to try to redirect them to nearby locations. In one emergency case, a female patient, unfortunately, the distance of 30 kilometers was too far. The patient passed away during the trip. This and many similar incidents should be a wake-up call to prepare and invest in the security of the healthcare ecosystem. You may now ask, could we actually have been prepared for such kind of scenarios? And unfortunately, my answer is a clear yes. For this purpose, let's have a quick look at the cyber report from 2019 from the US, 1 year before the pandemic. In 2019, in the US alone, more than 40 million healthcare records were either exposed, stolen, or illegally disclosed in 500 plus major attacks. These are data showing the market in the US alone. Imagine the global scope. So for the future, my first recommendation, all stakeholders need to better secure the IT infrastructure from cyber threats. Equally important is the education of personnel in cybersecurity. Just as a side note, Cisco offers a variety of comprehensive online courses for education and awareness building as part of our social responsibility program. We offer these courses free of charge to anybody in need. Please reach out to me after the presentation if you need more information about it. Now, let me move to telemedicine and video consultation. Dr. Sarah Said Quram shared her experience using these applications in the field in Pakistan. So would we have these solutions, video consultations and other digital health applications properly in place before the pandemic, they would have significantly helped to reduce the physical pressure on the healthcare system during the pandemic. Video consultations offer a variety of benefits beyond the pandemic. We have heard a little bit about this in the last presentations. Cisco has been delivering hardware and software solution technologies in the past years and has also showed the benefits of video consultations in the healthcare environment. For example, video consultations can be easily used for routine consultations, treatment progress, regular checkups. By that, reducing the physical pressure on the healthcare system, and at the same time, reducing the risk for infection for medical staff and patients alike. Several studies have shown that the numbers of no-shows are significantly reduced if done via video conferencing, saving human resources, time, and cost. During the pandemic, video conferencing could have been used for internal communication, for example, with patients or medical staff in isolation area. By doing so, reducing the infection risk of medical staff and other patients in the hospital. Second opinion or a tumor board can be set up within minutes to bring patients from around the globe with doctors from around the globe to the table to discuss a patient case. During the pandemic, virtual family visits could have been set up within minutes, helping people who are in quarantine, who sometimes haven't seen their family for weeks, for even months, to stay in touch. Finally, the flexibility to deliver remote care without boundaries will have a major impact on the healthcare system as we know it today. So with all these benefits, where do we stand in the adoption curve of video consultations? In a survey from 2017, 50% of medical staff and patients were against video consultations. Now, due to the pandemic, we are seeing a shift in the mindset. Comparing the data from Q4 2019, a few months before the pandemic, with Q1 from 2020, a few months into the pandemic, we see an increase of 127-fold in adoption using video consultations in the German healthcare system. In some areas, for example, psychotherapy, this increase is even higher and more than 900-fold. From all doctors who are using video consultations today, less than 6% have been using video consultations a year ago. This means an increase of 94% of adoption using video conferencing solution in the healthcare environment. Video consultation is one of the promising technologies that will help to reduce the pressure on the healthcare system. Due to the time limit we have, I will only briefly mention a few others. Emerging technologies, including wearables and sensors, blockchain, robotics, IoT, big data and AI will help to optimize processes and procedures, to streamline the patient journey, and help medical staff to deliver better, more efficient healthcare in the future. So for the future, video consultations and other digital health applications need to be part of the standard delivery of care. In order to make this a success, the right environment, the right technical environment, the right legal environment, and the right incentives need to be in place for the different stakeholders. For example, one current issue hindering and blocking these applications to be integrated is the reimbursement issues. These questions need to be addressed in the future. With this all said, all these promising technologies and applications are literally worthless if we don't have the right modernized healthcare IT backbone in place. What we can say about the healthcare system of the future is that it will be patient-centered, it will be interoperable, and it will be connected. All stakeholders in this ecosystem will have the ability to quickly interact with each other and to quickly share data with each other. One of the strongest enablers for such an ecosystem is a stable, secure, and modern IT backbone that connects the different stakeholders. This is currently not the case. This is also one of the main reasons we are facing extreme difficulties in rolling out a vaccine and in managing to collect the numbers of people that are currently vaccinated. As you know, many cantons had to stop to register for vaccination, people for vaccination due to IT problems. For example, due to the high number of accesses, there was a technical problem with the data storage capacities throughout Switzerland, and data of about 10,000 people could not be properly stored, undermining the efforts to quickly vaccinate the population. In fact, one of my colleagues was affected, so he registered with his father and got an appointment for the vaccinations. Luckily, he printed out the paper with the date. He went to the vaccination location to do the vaccinations, and they told him, "You're not in the system." Now imagine you have 10,000 people in this situation, how much it will slow down the process. We also have all heard about COVID numbers being reported using legacy systems such as fax machines. Let me break that down to focus areas using a hospital as an example where we need to focus first. The core of the hospital operation is the data center. A stable and secure network allows to move data from and to the data center. This combined with security establishes the foundation of the healthcare IT backbone. Currently, we see a significant increase of data storage demands due to usage of rich media or video application in patient files. Electronic health records will further increase the demand for data storage and network bandwidth. At the same time, patient expectations, the pressure of multiple applications and devices will lead to increased network traffic. Lives literally depend on clinicians' ability to quickly access critical patients' data, to make the right decision quickly in order to help the patient. So protecting and investing in a network's integrity, reliability, resilience, and security is essential. So is optimizing performance and increasing bandwidth. Of course, at the same time, a range of other solutions, including authentication, data loss prevention, mobile security, physical security, and threat prevention need to be in place as well. At the network level, latest technologies, including IoT and wearables, do not work on legacy infrastructure. So an upgrade to a modernized IT infrastructure is absolutely essential. Now, for a second, think about the two cyber attacks I introduced earlier. The first one in Switzerland attacked the data storage capabilities and encrypted critical data. The second attack from Germany disabled the network and made most IT services inaccessible. This leads me to my next recommendation. In the future, healthcare providers need to invest in a secure, stable, and reliable IT backbone. This will enable to use latest applications and technology and help to reduce the physical pressure on the healthcare system. With this, healthcare providers will also be agile enough to better cope with situations like a pandemic or disasters. This, of course, applies to all stakeholders listed in the ecosystem before. Let me quickly conclude. I hope I could demonstrate that a secure, modern healthcare IT backbone is the foundation of a digital-ready healthcare system for the future. Only then the latest technologies and applications can be used to streamline processes, optimize the patient journey, and make healthcare more efficient, reliable, and agile. With that, thank you very much for your attention, and I'm looking forward to your questions.
Dr. Garif Yalak from Cisco, thank you very much for this super interesting presentation. Garif, you were mentioned several times how important it is to train medical personnel in terms of cybersecurity. My question though, these people, they have a 24/7 shift. They have to take care of all the patients of COVID and all the other sicknesses we do have. How can they do it? And if you suggest with whom you would start to train this, it can't be simply be the job of a nurse to be trained in cybersecurity. How is your advice on that one?
Thank you very much for this question. I've briefly touched on the importance of having the right infrastructure and security solution in place. Equally important is the education of personnel. So a study from the UK Information Commissioner showed that 90% of all breaches in 2019, total 2,400, were due to human error. This number, interestingly, is increasing over the past years. It was at 61% in 2017, grew to 87% in 2018, and to 90% in 2019. So this is absolutely essential to educate every person in healthcare, working in a healthcare environment. That's a very good question you're raising. As I mentioned, there are online courses. We provide, for example, many online courses for awareness building and for education for all kinds of personnel. I think this is the first start for healthcare personnel to be educated in cybersecurity. Of course, the right environment needs to be in place. The hospitals, healthcare providers need to give the personnel the time to educate themselves in cybersecurity. And with complexity in IT and increasing workload, as you said, it's absolutely essential to stay on top of what is happening in the cyberspace.
Yeah. Garif, the time is running, but I still have another question for you. You said that there was an adoption of 94% in using video consultations, etc., but still there are people against it. What do you think is the biggest challenge there to overcome?
There are multiple use cases where we have done pilots in Switzerland, for example, and medical doctors as well as patients were happy with the results during the pandemic. So most of the hospital went actually back to physical meetings for the single reason because they can reimburse at higher rates. They use the same resources, the same time, but using video consultations is just reimbursed at a very low level. So this needs to change. And this is true also for other technologies. The right incentives need to be in place to make these novel technologies also bring benefit to the healthcare system.
Dr. Garif Yalak from Cisco, thank you very much for this super interesting presentation. Please stay with us. 10:40, we are going to welcome Nicole Formica-Schiller. She's talking about AI and blockchain in healthcare. Again, Garif, thank you very much.
Thank you for having me.